right, so if you know it's Wednesday, we cannot finish the show without discussing your health. And today, as a nation, we just want to take a look at where we are when it comes to maternal health care in Kenya. And of course, our way in is Beyond Zero. Let me introduce my guest this morning. I have Angela Langat with me. She is the coordinator of Beyond Zero. It's good to have you with us this morning. And I'm so glad that we're having this conversation. So, as every Kenyan know, we haven't had the marathon for 2 years now, and something that Kenyans would always look forward to. Can we see it coming back this year? Will we see it coming back this year?
Definitely. Thank you so much for having me today.
Right.
As you said, my name is Angela Langat, and I'm the coordinator for Beyond Zero. And yes, it's coming back on the 10th of March, starting off at Nyayo Stadium. There's a 21-kilometer race, 10-kilometer and 5-kilometer race. So I'm urging everybody to come and just run with us.
And participate. So Kenyans would be curious what happened to those 2 years, because it was something that Kenyans would always look forward to. Right.
As you know, that High Excellency's strategic framework was launched in 2014 and went along up to 2017. So what then happened was that we needed to stop and just reflect on the past and think about what have we learned and what do we want to do. The first strategic framework focused around promoting better health outcomes for mothers and children, especially around HIV. So we thought, what can we do more? So this new framework, which I've come with a copy, is a bit broader than what happened before, and it targets the life cycle approach, focuses on different touch points from when a mother is pregnant, when the baby is born, an adolescent, a young person, a young adult, and then an older person. So this new broad framework is it's bigger than what was there before. So that's why we took that 2-year break, so that we could reflect on what we wanted to do going forward.
And speaking of reflection, the new HIV infections among children had reduced from about 13,000 in 2013 down to 6,100 in about 2016. And 1 in every 26 children in Kenya dies before reaching the age of 1. And this is something that Beyond Zero continues to tackle as it provides solutions. Angela, what else, as you were reflecting with the team, with the Beyond Zero team, what else did you see? Okay, we've done this right. The numbers have reduced in certain things. What else and where perhaps needs more attention? Just take us through some of the achievements that Beyond Zero has been able to do in that span of those 4 critical years.
Okay, so making reference to this document that High Excellency launched on the 8th of March, some of the performance indicators then in 2013 were high. And then now when we look at 2017, they've drastically reduced. We're making very good progress as a country. When you look at the number of new HIV infections among children, they've actually halved. When you look at access to pediatric treatment, it's actually increased. So we are making progress. But what happened now when we are reflecting and saying what needs to be brought to the fore? What does High Excellency, the First Lady, need to increase visibility around? And one of those things was nutrition. Because nutrition is a very important thing for the first 1,000 days of a child. So how then do we leverage on the work that the government is doing both at national and county level so that we have more children? We focus on the first 1,000 days. And then the other thing that we thought we should increase visibility was around assessment and registration of children with special needs. Because that's an area that is not talked about around the country. And so we thought that's a good place to start.
Children with special needs, children living with disability.
Yes.
So you want to even have more focus on that as well.
Yes, and just increase, and for her to lend her voice around that, so that we have more children, more mothers or more families bringing their children to facilities for them to be assessed, for them to be registered on the National Council with people with disability so that they can receive help from government. Yes.
And the feedback from mothers, because I'm sure you're on the ground with the First Lady and you get to see if women are responding positively to the call to action.
Yes.
Is that the case?
Yes, it is the case, and I can just mention a very recent, what we started off as regional medical safaris. So we've done one in Narok, and then we've done one in Kisumu, and the stories are just phenomenal.
Medical safaris?
Yes.
What are medical safaris, Angela?
I think we call them safaris because we're actually moving around the country.
Okay.
Typically, when you go to a safari, you move from one place to another looking for a particular, say, animal, if it's the lion or, yeah. So the safari will happen around the country. It takes place within 3 days. So we set up camp in one place. We work with different and collaborate with different partners, county governments, private sector, community health workers, volunteers from universities. So it's a very big medical safari.
I'm sure it's doing well in places where accessing quality healthcare is a problem, where you think about going to the hospital and it's quite a walking distance for the mothers.
True, true. So let me give you a story of this young girl that I met in Kisumu.
Okay.
She was 9 years old and she had a cataract on her right eye. And it was just phenomenal to see how her father said, you know, I came here because I knew I'm going to get a free service because we provide free screening, testing, and referral services. And he said, I'm going to take her to Kisii because you've provided that surgery for free. And it's just amazing to see the kind of work Her Excellency is doing to touch different people's lives. So the other thing about children with special needs, this lady in Narok, her child had never been assessed, had never been registered by the National Council, and it was the first time that she was bringing her child to such a place. So it is touching lives.
It is working, it's touching lives.
Yes, it is.
Okay, so we've already told us about the medical safari. Let's get back to this. This strategic framework, 2018 to 2022. Just give us an overall idea of what this strategic framework is.
Okay, so as I said before, this framework is a bit broader than the first one. Even if health for mothers and children still remains core to Her Excellency and the passion that she has, we've now integrated other elements. So when you think about a pregnant woman, because Her Excellency, the First Lady, is the national champion for elimination of mother-to-child transmission of HIV, she wants to rally the whole country so that we become the first country that is validated by WHO so that all transmission rates around all health facilities are below 5%. So for women who are pregnant, so we have that, and then we have obstetric fistula that we currently offer in all our medical safaris. So if you're suffering from an obstetric fistula, because it is a disease that has a lot of shame, we encourage women through different ways of mobilization to just come, we repair you and we restore your dignity. When you think about a young child, as I spoke before, it's about nutrition, it's about increasing visibility for children with special needs. When you think about an adolescent or a young person, it's about trying to reduce the multiple risks for HIV. When you think about a young adult or a woman or a man, it's about encouraging them to go for early screening for cancer so that you catch it early and then you start treatment. And then when you think about an older person, what can we do for the older people? Our framework says that come so that you get tested for, if it's eye care, that's what we do in the medical safari. We give an opportunity for old people to be tested for their eyes, and they're given free spectacles. So encouraging them to get on board with all government initiatives.
Okay.
Yes.
I remember the First Lady saying that maternal child deaths is beatable. Is that still the case still today?
Yes.
Can we say that maternal child death is beatable, that we are actually putting up a proper war on this, especially in 2019 or in the 21st century where we have technology, that we can actually say this is something that is doable, that in Kenya we can stop seeing maternal and child deaths happening at such a young age?
Yes. And I think that's why she even started Her Excellency, the First Lady, because she said, let me champion a cause that why are women dying from preventable deaths? Let me rally the government, let me rally private sector, community, so that together we can do something about it. So it is still relevant today. Initiatives such as Linda Mama that we promote in our medical safaris so that more women are going to a health facility, are delivered by a skilled birth attendant, so that our statistics are getting better when it comes to maternal deaths.
And speaking of statistics, I'm looking at the achievements that you have here.
Yeah.
So let me just read a couple for the audience so they can hear it. With HIV infections among children, before Beyond Zero campaign started, there were about 12,826. It went down to close to a half, 6,613 after the Beyond Zero campaign. And that's the HIV infection. I'm looking at the number of women who attended by a skilled health worker. Before Beyond Zero, it was only 600,000. After, 1.2 million women. The last one, maternal mortality ratio. Before Beyond Zero, it was standing at 488. After, about 362. When you see these numbers as the Beyond Zero team, what does this say?
In fact, when you are reading the statistics, it just occurred to me that we are not the only players in health. There are many other players. And because we are working together, all together, that's why we see such good progress. It's not because of Beyond Zero only. There's the government, there's private sector, there's NGOs. So together, that's why we have this kind of
statistics. There's a chain work of different institutions involved.
Yes, because everybody has a strength.
Right.
Our strength is advocacy. Beyond Zero is an advocacy platform, meaning that Her Excellency, the First Lady, lends her voice to certain issues. She will rally partners for resource allocation. She will rally partners for improvements around policy. She will rally communities for uptake of services. Right. So everybody is doing something.
I think of First Ladies on the African continent, and First Lady Margaret Kenyatta is quite active in certain places. Even within our Kenyan presidency, she is the First Lady who has been quite active and to engage in certain things that, like you said, she's passionate about. If you think of other First Ladies, Michelle Obama, she had the Let's Move campaign, which encouraged young kids to eat healthy and to exercise. In fact, she advocated that in schools, they should offer high nutrition food, not just giving food to schools. She had the Let Girls Learn campaign, which went even beyond America. I remember when she was in Africa, she championed for also girls to go to school. Here at home, we have First Lady Margaret Kenyatta, and Beyond Zero is something close to her heart. Why? Is it something passionate? Why did she choose healthcare? Why?
As I said before, she chose something that, because she thought, why are women dying? And are there preventable things that she can say or do or encourage so that less women die? And that is why she started. And when you look at, and in 2014, I remember, she went to the Organization for First Ladies Against HIV, and that's held twice in a year at the AU, African Union Commission, and just realizing how our indicators were so bad as a country, she thought this is the right time to catalyze action.
And she ran with health.
And she just ran with health. And
wow. All right. Like you said, this is not just a Beyond Zero campaign. You have all these different institutions, and like you said, every institution has its own strength. Perhaps you could tell me as well some of the challenges that you have come across that have been that have made making this initiative a bit difficult in the sense of actualizing our dream, our target as a nation. As much as we have seen the numbers, which are quite promising and they're quite encouraging, I'm sure there are certain hurdles that you have come across as Beyond Zero. Could you just paint that image for us?
And maybe I throw it back at you because I remember last year one of your journalists wrote a very interesting feature, very nice feature about Beyond Zero. I think she's called Angela Akech, and she wrote about the impact of the mobile clinics around the whole country. Right. And she went down to the field and saw the different activities that the mobile clinics and how they are impacting lives, because this is bringing a facility closer to people. And one of the things that she raised was the fact that some places the mobile clinic was not working. The mobile clinic in the first framework, because this is the second framework, was the flagship program.
Right.
So Her Excellency delivered mobile clinics to all 47 counties. And then where there was extra need, she gave more. So to date, we've given 52 mobile clinics. So when she gives that clinic, it's a gift to the county government. It acquires a status like any other health facility in the county. In this case, it acquires what you call a level 3. It's able to get consumables, medicine, health providers. Okay. But because she's given to the county and health is devolved, she cannot interfere with how it's run. So the county government, like any other health facility, allocates budgets for the movement of the mobile clinics.
Right.
So in places where the utilization has been very good, the counties have purchased extra mobile clinics for themselves. Yeah.
Okay, beautiful. As we are winding down the conversation, audience might be asking, why a marathon? Now that as we're preparing for the next one, which you said is in March. Why a marathon? Why do we run?
Why do we run? When you look at all the marathon series around the world, who are the marathon runners? Kenyans.
Kenyans, right?
So,
the Kipchoges.
Exactly. So to pay homage to our runners as a country, because the runners come from here, but more than that is to create awareness around the things that she's passionate for. It's actually like a health marathon. So when you look at the different areas that she's interested in, so for example, if you say you're going to come and run on the 10th of March and you're passionate about children with special needs, so you run. Maybe because you know somebody who has a child, or you have a relative who has a child who has Down syndrome or autism, but you're running to create that awareness.
All right, so this framework, the one that you have right there,
Yes.
is running between 2018 to 2022.
Yes.
But specifically for this new year, now that we're in January, for 2019, what are some of the activities that Kenyans can look out for, and how can they be involved?
Okay, so the first one is a marathon. And then the second one, so we're going to continue to do the medical safaris around the country. And we are targeting to do West Pokot. We'll go to the coast, we'll go to the northern part of the country, and we'll go to eastern. So we are calling on Kenyans to come. When we have the medical safari, come for free screening, for treatment, and for referral services.
Right.
Yes.
I'm glad you said West Pokot. Those are some of the areas, unlike Nairobi, that are being marginalized. They're far away from the
Yes.
medical services.
Yes,
So
yes.
West Pokot is one of them.
Yes,
and
yes.
coming for screening.
Yes.
And of course, we have the marathon in March.
Yes.
So it's going to be a busy year.
Very busy.
All
yeah.
right.
Yes.
Angela, thank you so much for your time.
Thank you so
Thank you for
much.
coming. Thank you for
Thank you.
helping us understand what Beyond Zero has planned for the next strategic framework. It's
Thank
good to
you.
have this going on. And you also brought the T-shirts.
These
That's
are
the-
freebies. So for the first person who will register themselves online on www.
you can do it online?
Yes.
Okay.
You get a free T-shirt and a sling bag.
And a sling bag.
Yes.
Fantastic.
Yes.
Will they also get like a booklet sort of like this to also help Kenyans understand the framework?
We have a training guide,
Right.
and the framework is online, so people can
Right.
access.
I can't help but notice that even this specific framework is well strategically placed with the SDGs.
Yes.
Was that on purpose?
Yes, you have to remain relevant to
The
the
Big Four
context.
agenda?
Yes, it's aligned to the President's Big Four agenda, specifically supporting universal healthcare coverage, increasing access, ensuring that through the medical safaris, we encourage people to register on NHIF so that you protect yourself financially when you're sick.
Right.
Yes.
Before we close off, someone might be asking, as a man, what is my role in making sure that maternal deaths are reduced?
In fact, that's a good question because one of the target groups is actually men, and in terms of them seeking their own health, for their own health behavior to improve and want to go to a facility because they are a man. So we encourage that during the medical safari. Yes.
So men can also be part of that?
Yes, yes. They come for screening. They can be screened for prostate cancer.
Okay,
Yes.
fantastic. Thank you so much, Angela.
Thank you.
That is Angela Langachi, is the coordinator for Beyond Zero, just helping us understand the framework, the next steps for Beyond Zero for the next 2018 to 2022 framework, and how you can be involved. As she has said, register, and the registration can be online. You don't have to go get papers. The next marathon will be in March, and as Michael has said, you have about 1 month to sort of prepare physically and get able to prepare for that. So we want to close off the show, but I'll hand over to my colleague Michael Gitonga, who will wrap it up for us. But thank you so much for your time here on Morning Express. I'll see you tomorrow morning, same time, same place. My name is Zinzi Kibiko. Michael?
All right, and thank you very much, Zinzi. And I just want to know if you're going to be running yourself, because I'm preparing to run. We have a month, so you've got no excuses. So hopefully Zinzi and I are going to be taking up that challenge and ensure that you're there. It's all for a good cause. So just before we close the show, a quick look at what has been coming through on Twitter, and this is to do with the question that we asked earlier on on your thoughts. What are your thoughts on President Uhuru Kenyatta giving more powers to Dr. Fred Matiang'i? And Sir Johnson says that Matiang'i is undisputed performer and we like him, but his hand will be tied if no political goodwill. William Ruto enjoys a huge parliamentary support, and this might be used to lock him out of the boat. We also have Dr. Wasiki Okila, who says Ruto has been replaced. Well, is that how you read it? What do you say? Mabo says that Matiang'i is no joke. Fellow, we all know he's certainly a performer according to many. We have Lillian Mogutu, who says that Dr. Matiang'i means business.
All right, Jeff Abraham
and, yep, go on.
is saying this is sabotage. If you know, you know.
If you know, you know.
If you know, you know.
All right, and keep your comments coming. It is a good move. The president is effectively making development only about development. He is not seeking to be re-elected. Raymond Sure says, I think it's timely that the president does this. The deputy, in the name of inspecting the implementation of the Big Four, has been campaigning, thus renders him irrelevant. Matiang'i is hardworking, determined, and delivers.
James Minor, that's very good of him. He is able to fight corruption and other vices. My views is that he should also think of giving him other dockets. Evelyn, you say he is a performer. If he gets support, he develops systems, he should be okay.
All right, and that brings us to 13 minutes to 9.